while physically they are now in menopause, which means that they may suffer vasomotor symptoms, hot flashes, night sweats, and what we need to talk about in sexual health is GSM, genitourinary syndrome of menopause, GSM. So premature ovarian insufficiency has a psychological consequence. These are young women who are faced with the loss of fertility, and their loss of what they expected was going to be something they would have until they were 51.
2 years ago, she did a lab test that showed a decrease in circulating levels of estrogen.
And in mind, number one, at 19, she had an abortion, and there are going to be many providers who would say, does she feel guilty? Is there any psychological? And for the most part, no. And is that just her general sense of men? It may be, since all of her relationships have been with relatively immature men. I'd like to know what that is.
The fertility, if you attend a fertility clinic, they don't put these boundaries.
Since we're talking to therapists also, it's important, if you see things that are obviously not covered, don't assume everything is psychological.
If a partner is not available for couple therapy, but you as a psychologist think that the main point is there are a lot of points that are relational, or at least need to be addressed with both of them in your room.
Which would mean in vitro fertilization, to retrieve what few eggs she has that are viable to see whether they can be fertilized.
With the body and the mind, he was always saying to her, you need just to relax. So he was also not taking into account the organic cause of
because with unopposed estrogen, with the uterus intact, you need progesterone. An oral or a patch, right, would for the most part take care of the vasomotor symptoms and organs sensitivity, but for some women it's not enough to address genitourinary symptoms, and so